If we look at the status of hunger around the world, Africa and Asia account for 90% of all cases. And Africa is disproportionately affected. We're roughly about 12% of the world population, but about 30 to 40% of all people going to bed hungry. And this has major implications, particularly for child survival and development. One of the worst indicator of malnutrition and hunger is the level of stunting among children, where in our region in Eastern and Southern Africa, we have rates that reach up to 53% of all children being stunted in countries like Burundi, Madagascar, Ethiopia. And this has major implication for the physical and cognitive development of children that translates itself in their health status and in their ability to learn. And of course, they being the future citizens of the countries that has major implications for development. To ensure optimum nutrition, we do need not only food security, but also nutrition security. That has implication in terms of quality of food, but also access to water, access to sanitation, and also hygiene. And that all together combined will improve the quality of life of children and then the quality of the nutrition that they get.
Thanks to the efforts made by Ethiopian government to reduce child mortality, the results that we have achieved through this intervention is reduction in child mortality through high coverage of supplementation and child screening and the OTP services. And this is as a result of active community involvement and also partners' involvement is also crucial.
There has been fantastic progress in Ethiopia in terms of addressing malnutrition. First, through the establishment of a national nutrition policy, which has really provided the framework for responses. And the most important parts of the response have been treating severe acute malnutrition at the community level. Led by the government's health extension program, Ethiopia has been able to expand the reach of treatment of severe acute malnutrition at community level. In 2008, we had less than 500 sites treating children. We now have 7,700 sites, reaching on average 200,000 severely acutely malnourished children each year. We've had very low mortality, very high recovery rate as a result. In addition, we have a very exciting program called Community-Based Nutrition that focuses on preventative nutrition. It's a program that reaches 1.6 million children in about a third of the districts of Ethiopia. Eventually it will be rolled out to the country as a whole. That program focuses on community engagement and a dialogue about nutrition. It focuses on growth monitoring to make sure that the children are weighed. Those children that are progressing properly go home with the increased knowledge from the community discussion. Those children that have problems are referred to either programs that deal with severe acute malnutrition or programs that deal with moderate acute malnutrition. Because it's a preventative program, we catch the issues early, and as a result, there is a profound impact on the nutrition of the child. What makes this program successful is, first of all, we are all working under one policy, the National Nutrition Policy. And when I say all of the partners, the World Bank, World Food Program, Japanese government, several of the NGOs, as well as Unicef, collaborating together in support of the government.
The community-based nutrition program involves community through growth monitoring and promotion session conducted by voluntary community health worker to support mother to understand the nutritional situation of her child. After this all information will go to the community, and the community will discuss on issues why malnutrition is happening in their community.
Jiramina fide ilma kiyya duraana rafayyaa dhabee jira amma egaan dabar maa fudhadhe naatti wayyaa'ee jira jechuudha.
Faayidaa gurguddoon irraa argadhee jira. Amma rakkoo mucayyoo kiyya kanarra geesse irraa naa fayyee jira kana. Akka kanarraan seenneefis injifadheetiin jira.
To reach the nutrition MDGs, we have to make sure that we work with government partners because leadership is very important, and the creation of an enabling policy and programmatic environment to implement the programs. Then technical partners, such as the UN, the Unicef, together with WHO, FAO, and the World Food Programme are very critical. Partnership with private companies, such as the food producers, as well as the salt producers, and not the least, the partnership with civil society organizations, that help change behaviors and attitudes and then build capacities of mothers and communities to contributing into reaching the nutrition-related MDGs. Our hope for the future, and that is what is motivating us every day in our work, is that no child goes to bed hungry. And today, with the resources which are available, the new technologies that we have, the new techniques in food production, and the different interventions at the level of the environment, at the level of the investments in terms of resources, it is unacceptable that so many children in our region go to bed hungry. And our hope is to change that dramatically by focusing on the most vulnerables and reducing the gaps and disparities between the rich and poor, and then the rural and then urban areas.